Hi, I'm Dr. Steve Swengel at Refined MD, and I'd just like to talk with all of my followers about some of the things we're doing at Refined MD that are new, kind of twists on systems that have been used in the past, but we're now doing it differently. And I'd like to start off with some of the laser treatments that we recommend. We have virtually every laser there is, and understand too, as you're kind of researching lasers, that the technology is there, that there are a lot of Me Too sort of new products in the market that are nothing different. So the lasers that I really like to rely upon for people who are just kind of looking at, browns, sun damage is just really causing that kind of muddy discoloration in their skin, and just that loss of texture, pore size, just wanting to kind of refine the surface of their skin. I like to actually start with a treatment that to me is just the cornerstone of therapy that's called broadband light. It's BBL for short. This is a system developed by Sciton Lasers in Palo Alto, and it actually has an amazing track record of safety and efficacy. What's actually interesting too is that because people in the South Bay now have been using either BBL or IPL for the last 20-25 years, they began to notice that those people who really stayed with it and kept doing at least a couple treatments a year, they actually, even though they chronologically were aging, their skin was not aging. So Sciton actually sponsored a study at Stanford University that looked at what was going on, and what they realized was that there's some component of broadband light that actually shuts down the aging genes in the skin. So I even say to people, if you have the skin type that's actually appropriate for BBL, that even just doing a couple BBLs a year literally shuts down the aging genes to your skin. So that should be the cornerstone of everyone's skin care, assuming that you're kind of my skin tones and lighter. As we get into darker skin tones, we have to be a little more careful because BBL can actually stimulate pigmentation. That's the point that I actually then will kind of step up to some of the lasers that are actually fractional lasers, and we have multiple ones of those too. We have the original Clear and Brilliant, we have LaserMD, which is a system devised in South Korea, and Halo, which is again a Sciton system. And then for those who are bold enough to go there, we have profractional treatments. That's kind of the step ladder of therapies too. So for someone who wants to kind of start off with a very gentle treatment, I think Clear and Brilliant again has a track record of giving results, but you're able to literally go out to dinner that night, but you have to look at multiple treatments spaced 1 to 2 months apart to start seeing those end results. LaserMD is an interesting one because it actually is the same technology that the Clear and Brilliant Premea has, but it actually is a more powerful system and can go that much deeper into the skin. And it was kind of interesting because the LaserMD was developed in South Korea and was specifically focused to be relatively color blind. So it's a system that can be used very easily on Asian skin tones. Again, we have to be careful upping those energies too high on people who have a lot of pigment in their skin, but it's actually a good, safe laser to use for virtually all skin types. The recovery from this is a little bit more than Clear and Brilliant. You walk out of the office pretty pink-faced and warm, and then that heat kind of stops, and then you have a very sandpapery feel to your skin for about the next 3 to 5 days. The Halo is actually the world's first and only hybrid laser system, and Halo was my choice over Fraxel, because Halo actually gives you the Fraxel-like energies in their 1470 technology, but then they also give you erbium technology, which is drilling deeper holes into the skin. So we have both a non-ablative and ablative system together, so you're getting the best of both worlds with Halo. Again, pretty easy downtime. You're going to be sandpapery for 3 to 5 days, but that sandpapery look is pretty coarse sandpaper, but the skin's amazing when all that sandpaper wears off. Now, profractional is kind of the ultimate treatment, but that's a treatment where I say to people, you've got to do some other treatments first before you step up to profractional, because with Profractional, if I give you a good treatment, you will literally awake and stuck to your pillow the next day. But that sort of a deeper injury really stimulates a really aggressive, wonderful collagen formation. In addition to that, what we can also do, and this is something I can talk to on YouTube, is we look at various products and systems to actually stimulate an even more robust response to the treatments we just gave you. You've probably heard of PRP, platelet-rich plasma. We also now have platelet-rich fibrin, exosomes, and then stem cell therapy. And each one of these uniquely can stimulate your body to respond even more aggressively. What we do with these is based on your choice, and what we think is the most appropriate form of treatment is we actually plate this onto your skin after the treatment, because the fractional lasers actually open up your skin so that there's the ability to get stem cells and exosomes and your platelets down into those injured areas to actually stimulate and support a more robust repair process. The newest one we have is stem cell therapy using umbilical cord blood. It's a system called VidiPure that we are one of the few offices that have this right now. And what it is providing you exosome levels that we really can't provide with any other system. They've also shown that some of the peptides, the cytokines, all the products in platelets that actually are the real supporters of healthy skin growth actually decline as we get older. So the two variables that we deal with in our patients is as you get older, your platelets are less charged with those active products. And also, I personally experienced the fact that I have a low platelet count. And so low platelet counts mean that we harvest your platelets and you're just not going to get much in the way of results. So more and more I have people stepping up to pure exosomes or this new system called VidiPure. So that's kind of where I would take most patients at this point in time as they enter, what can I do to keep my skin from aging and to keep it looking as fresh and as healthy as ever. Well, Pico switch lasers and Q switch lasers are all the same technology. They use two different wavelengths, 532 and 1064. There is a 1064 in particular is a skin rejuvenating laser energy that not only is on that system but on my XLV and also on Genesis, which is something I didn't even talk about. But there's a stimulating of collagen and a shrinkage of small vessels in the skin when you use 1064 technology. Now the difference between Q switched and picosecond is the speed with which the energy is delivered. The picosecond lasers are actually trying to say that they're definitely that much better, but if you have a Q switch system that is very close to a picosecond sort of energy level, you really get the same effect. And our QX Max is right up there at the picosecond sort of energy delivery. What we like to have patients do is to come in, sit down with our patient care coordinator, get some photographs taken, some Visi analysis, and then we actually, with our knowledge and expertise, can actually help you pick the right pathway to get the best optimal results with the least risk of any downtime or injury that otherwise an office with very few lasers to choose from might accidentally create. Do we need to pre-treat before a laser treatment? And for a lot of these, some people can get through a treatment with very little discomfort. Other people are pretty sensitive to some of these. So we typically offer at least a half hour to 45 minutes of pre-treatment at home with a topical anesthetic. I think what it does, it makes it a lot more enjoyable, I guess is the term I'd want to use. But it makes people not afraid to come back and get another one. If you really slap someone around with a laser where it really hurts, the problem is they'll have great results, but they're just like, I'm not going there again. So I like to have it so people say, that wasn't a bad experience. What should patients do on their own to start combating aging to their skin before they even come to the office? I think probably the most important thing to do is to make sure you're using a good high SPF zinc sunscreen for your skin, because two of the most common impacts of aging to the skin are sun exposure, chronic sun exposure, and the second I would have to say is smoking. Smoking is just horrible on your skin. And we don't really have a choice in this, but I've always jokingly said you need to pick your parents very carefully, because I think there are those people who inherit good skin from parents who've aged well, who have the right kind of skin type that can handle kind of elemental exposure. But those are the most important ones on a daily basis. The other thing is what you can do on your own is look at using retinols, look at using some antioxidants like vitamin C or the organic antioxidants, just to kind of support kind of free radical damage in your skin. We have a lot of great products in those categories. We have a huge range of retinols, retinaldehydes, the full prescription tretinoins, and then in these vitamin C, we have a couple that are favorites of mine. The Revision C Correcting Complex, which actually helps with pigmentation, has the highest strength C system of all the products. But C Ferulic is a well-known one that I love. It helps to brighten the skin as well. So there are just a lot of products to choose from, and a lot of that's based on your skin type and what you're hoping to achieve. The question is, should patients start with some prescription or at least more aggressive home care systems before they do office treatments? I think that skin that has been basically stimulated to start turning over is basically kind of ready to repair and recover. It will do better with having that under your belt, being used at home for 2 or 3 weeks before you come in and start doing office-based treatments. I find that the people who are usually the least impressed and sometimes the most disappointed are people who kind of come in and say, I'm just going to use Pond's cream. And I'm like, well, you're doing nothing to support the systems that we're using to try to stimulate your skin to turn over at a better rate.
Yeah.
Well, that's kind of a good segue to some of the products that we have that are unique to medical grade offices, and it's patented technology. And right now we have 5 patented technologies that I have to say that patients can basically use any or all of these, because each one addresses a different issue. Definage is a patented technology with the peptide called Defensin. We've had several discussions about Definage, but Definage just keeps winning awards for best product every year, and I personally have found that it seems to be one of the best products on the market, because what it does is it actually turns on stem cells that are quietly resting in your hair follicles and oil glands, and those actually move up and repopulate the surface of your skin with brand new cells. So we're not trying to stimulate old pre-existing cells, we're actually repopulating with brand new cells. There's then Sente, which uses their patented heparin sulfate analog technology to basically introduce the building blocks, the mucopolysaccharides of our skin. And the dilemma there is they had to come up with a technology to get these particles so small that they go through your skin. The next one is Elastin. Elastin uses a peptide system called Tri-Hex technology. And Elastin's has always impressed me that they took the time and effort to show the histology of what's happening in pre-treated, post-treated skin. And what the Elastin products do with Tri-Hex technology is they literally just removed old, basically collagen and elastin that's kind of denatured and not really providing anything supportive for your skin, and allow your body to repair and replace both collagen and elastin. So it's one that we like to use around the time that people are doing treatments that are fairly creating injury to the skin, because that's what really supports that process. And then there's Hyology, which is actually a Japanese product. It's very interesting. That company actually won the Nobel Prize, or one of the researchers won the Nobel Prize for their nanotechnology of making hyaluronic acid so small that it goes right through your skin. So this is actually a system of very elegant products. that actually really plump your skin and can remove some of that frustrating dryness that people find that's really due to the fact that they've lost the HAs in their skin with age. And we don't carry the whole line. We just carry 4. We carry one for the eyes, one for the face, an amazing lip cream for dry lips, and then a body cream. And that's all we carry out of that line. But patients who try them love them, come back and get others. And the last one is Impel, which I was just talking to a patient today about this. She came in and she said, you know, when I hit menopause, my skin went south so fast that I just couldn't believe the damage and the aging that I saw. And I said, bingo, you're the right person for Impel. Because Impel is actually, again, a patented ingredient that is what they call an estrogen agonist. And what that means is that when applied to the skin, it's absorbed and it functions like estrogen in your skin. However, when your body absorbs that estrogen agonist, it can't get converted to estrogen byproducts, which are potentially putting women at risk of ovarian cancer and other, estrogen-related cancers as they get older. So, Impel actually gives you the estrogen effect without actually exposing your body to systemic estrogens. Those are kind of the 5 big patented products that doctors' offices are the only place that carry it. You can't find this stuff at Sephora or Ulta. What's also interesting too is Definage is doing so well. They're now actually brought out what they call their Platinum Pro line, and that actually will be the only product that we sell as an office once we get rid of our remaining inventory of the original Purple line. I mean, the Purple line was great, but the Platinum Pro is sold only in the office, and it provides probably about 50% more efficacy than the original product line. So if you want to step up to it or you want to come in and replace, I would say definitely step up to the Platinum Pro. Another technology we offer for women is what we refer to as feminine rejuvenation. And this is a treatment that is basically selected based on a woman's issues as she's getting older and losing the estrogen effect to her tissues. I have a female nurse practitioner and an RN who provide these services, but we have 4 of them. We have Thermiva, we have FemiLift, we have Fem360, and we have Emcella. And the reason you're not seeing as much of this being discussed in the press and being advertised is the FDA basically shut people down, because even though the technology was considered safe and was FDA approved because of the technology, these companies never really provided good reports on what it was actually doing in the feminine rejuvenation process. But Fem360 and Thermiva both deliver radio frequency to the moist vaginal tissues as well as the external genitalia. So what we're trying to treat there is improve blood flow, increase secretions, increase sensation, and actually some shrinkage of tissue. So for women who are kind of complaining about all those issues, we generally recommend that they look at the RF technology. The FemiLift is actually a fractional CO2 laser, so what that's doing is designed to specifically just treat the interior vaginal mucosa, and is literally drilling little holes in the vaginal tissue. It's painless, it works, but what happens again, just like on the surface of your skin outside, that you drill little holes in skin, and that skin repairs, replaces, and returns to a more resilient, elastic sort of appearance. So it truly just causes tightening and rejuvenation of the mucosal tissue of the vaginal walls. Now, what we're also doing now, because I think for a lot of people, for a lot of women, it's a little bit of both. So one of our really favorite packages that seem to be popular right now is 2 of each. So my nurse will actually schedule a Thermiva and then a FemiLift after that, and bounce back and forth. The Thermiva is good, particularly if there's external laxity that needs to be treated, because that wand allows us to actually treat outside the vaginal vault and get some tightening of the labia, the clitoris, and just all those areas of female anatomy. I didn't also mention the Emcella. Emcella is something that I think one of our packages actually includes some Emsella treatments, but this is electromagnetic forces that actually stimulate muscles of the pelvic floor. What happens is, again, with age, particularly after having multiple vaginal births, that the pelvic floor just weakens, and those muscles just don't have the strength that they used to. And you can be told to do all the Kegels in the world, but the problem is that it takes a lot of Kegel exercises to get any real improvement there. What Emsella does is it takes you way beyond the muscle stimulation that a Kegel will do, and this gives you, hundreds of times more strengthening of the pelvic floor than all the Kegels in the world would otherwise provide. Well, we also can use Emsella for men for urinary problems, and also for overall increased blood flow. So Emsella is nice because it's easy. It is literally a chair that you sit on, fully clothed, so it's a very easy treatment to do. And after 6 treatments or so, people are saying, wow, they really see a big difference in urinary incontinence, pelvic floor strength, and just blood flow to the, to the entire lower pelvis. Questions about what systems we have to help with aging skin and some laxity that's kind of occurring over time. That's the non-surgical treatment. I think probably the technology that is probably foremost in all the treatments that we offer is some degree of radiofrequency, maybe along with another form of technology with it. I just was thinking there's another one that a Genius could be thrown there too. Basically, the treatment mostly focuses on using radiofrequency at some level to basically damage some collagen and build new collagen. And with that, you see tightening of the skin, improvement in the laxity and the overall skin tone. And we have 4 systems that do this, each one in a little slightly different manner. There's M-Tone, which is radiofrequency with a form of shockwave therapy to basically just to break up fibrous tissue and stimulate collagen with the heat. Yeah, I've always said kind of M-Tone is kind of like hot rock therapy. It's a lot of time for the therapist to do, but we take you up to as much temperature as your body can handle, and then once you've kind of reached your threshold, then we just keep it at that level, for the 20-minute period of time that you're being treated. The XLIS is very similar, but it uses radiofrequency along with a form of ultrasound, and that again is kind of a hot rock therapy where there's just rubbing of the skin as this system delivers both those energies, both in the superficial dermis as well as the deeper tissue. So you get some remodeling of fat and building of collagen at the same time. Then we also have Genius, which is kind of more on the derm side, but Genius now went from just having a tip that was designed for the face, where the Genius concept was microneedling with radiofrequency, where we deliver energy usually to 3 different levels, and the depth is based on what we're treating, where we are, what type of skin is there, and what we're trying to achieve. So, but now they actually have body treatment tips, which makes it much easier for us to get out and go after larger areas of laxity. When someone wants to do the lower face, the neck, and maybe the chest all together, we can actually get all 3 of those done pretty quickly with the body tip. Other areas are inner arms, inner thighs, kneecaps. It helps to kind of provide more energy to the external tissues where there's that kind of what I call crepe papery change to the skin that needs a more superficial treatment. The question is, are there any other non-medical device treatments for aging skin, for laxity, for just the changes we all start seeing to our skin? First of all, there's some products that actually will help with those aging changes. Alastin makes a product that's quite good. It's called Transform. And then Definage has come out with a new hand and body cream that amazingly was given top honors by Good Housekeeping of all places. They researched 955 different products and systems on the market and said Definage was definitely their top choice of products to use. First of all, there's Quo. Quo is relatively new on the market, and Quo is an extract from the Clostridium bacteria. And this is designed to specifically break down the fibroseptal fat that causes dimpling and rippling of the leg. So it was specifically brought out, FDA cleared for cellulite, but we're now actually taking it off the buttocks and going on the lateral thighs and seeing good results, just kind of releasing fibrous bands that give women that kind of ripply appearance to the side of their thighs, the posterior thighs. Don't use it much on the anterior thighs. I don't think it works as well up there. Then there's also all of these collagen stimulators we use, and I typically kind of stay focused on 2 products. We have 3 that are collagen stimulators and not fillers. The third one is Bellafill, and I think Bellafill, unless you're just dealing with very limited areas, becomes a pretty expensive product to use for large areas. The 2 primary ones that I resort to are Hyperdilute Radius and then also Hyperdilute Sculptra. What we also can do, if you're willing to kind of supercharge these treatments, is we sometimes will, like on the anterior chest, the décolleté, we'll actually put some VidiPure or platelet-rich plasma with the products that we inject, and then on top of it we'll even do a Genius treatment, because then the radio frequency and microneedling actually help to stimulate even better, more robust collagen building. So it kind of turbocharges the effects of the injectable collagen building products. So these are all just very customized based on what you're trying to achieve, what we think we can achieve, and what would be the best combination of treatments to make that happen. For those who are asking about what can be done that's a non-surgical way to basically improve the appearance of their face and neck without going under the knife. Obviously with fillers, Botox, some of the treatments I've been talking about, they make a difference, but they don't really go that deep. And we always have to be very careful delivering energy sources that potentially could put you at risk of melting fat and giving you another problem on top of what we're trying to achieve. But there's a new system coming out that's called M-Face, that's from BTL Technologies from Prague, Czechoslovakia, that are as part of the whole M-Sculpt Neo line. But this is actually designed to specifically focus on the musculature of the face and neck to actually tighten and lift the cheeks, the forehead and brows, and the neck. This technology was just introduced in January. It's actually FDA cleared and patented, so it's here. But it hasn't been released in the United States. It'll happen probably in late May, and we will be one of the first offices to probably offer this up for people who are kind of just saying, I would like to be able to get as much tightening as I can. I want to have it comfortable, and I want to just avoid a facelift if possible. I think frankly too, it also would be a good treatment for people who've had a facelift and who are kind of saying, what can I do to maintain that very expensive surgical lift I just got? Because a facelift doesn't stop the aging process, it just stops the clock, or resets the clock, as I guess it's a better term, but the aging process continues. So I think this will be a great system for people who aren't there for a facelift yet, and also people who've had one are saying, what can I do to keep from kind of sliding back into the way it was. So stay tuned on this one. I think that we will be going down to a meeting in Huntington Beach for a rollout of presentations to the big offices of California, and I have that feeling that we will have one of these systems in our office very soon.